Welcome back to Sleep Better TV. I'm Scott Drake, and my guest, once again, Dr. Steve Lawson with the TMJ and Dental Sleep Center of Winnipeg. Dr. Lawson, talk about the negative health effects of sleep disorders in general.
Well, the ramifications of not breathing effectively tremendously affect your endocrine system, which is a system that produces all sorts of hormones that effectively run the body, our metabolism, our growth and development. Growth and development's an interesting one, period. A lot of times with these kids who are not breathing properly, they're somewhat underdeveloped. They tend to be shorter. They tend to have, a bit of caved-in chests, for example. You don't secrete growth hormone unless you're in what's called N3 or level 3 sleep. And if these kids aren't getting there because they're not breathing well and there's a continual respiratory disturbance or event, you have problems with growth and development. In adults, and then there's the whole issue of ADHD. We referred to that before. With adults, cardiovascular disease, high blood pressure, type 2 diabetes problems. They're rampant if you don't breathe effectively, if you don't go through the proper sleep cycles. Your systems don't function properly, every system in your body. You can have digestive problems as a function of a neurologic event or a neurologic change in response to sleep-disordered breathing. The sympathetic nervous system becomes wired, and there you're not sleeping well because it's wired. You're stuck in what's called sympathetic dystrophy with central sensitization. There's just a whole series of problematic issues that arise if you're not sleeping properly.
Talk about when your patients, present themselves here. It seems like dental professionals like yourself can play a much more, significant role in the diagnosis of other disease. Because you're looking at, at someone's mouth, and that is, I guess, a window to their overall physiology in many ways. But talk about the role that you play, with a healthcare professional in many cases.
Well, this office doesn't do much general dentistry. We've been pretty much limited to diagnosis and treatment of temporomandibular disorders and obstructive sleep apnea or sleep-disordered breathing. Most of this is a referral-based. The physicians and chiropractors, physiotherapists, ear, nose, and throat specialists, they refer patients to this practice. So we see them when they walk in the front door here. These are patients who are already compromised and whose quality of life has been altered tremendously. They don't typically come here with a minor inconvenience. When we do that, or when we have a minor problem, we tend to go to the drugstore and take something for it. But patients that come here, they have a significant quality of life issue, compromised. They don't sleep well. They're in pain all the time. So from a dental perspective, the issue is that we can, once we've diagnosed that there's a problem we can help you with, and obviously with me, I'm limited to what I can do with the jaws and the airway, but I need the teeth to hold appliances, and I need the teeth healthy teeth and healthy gums to be a huge part of the equation. Maybe the difference between what I do and perhaps what happens in many dental offices is I look at the teeth as really the pillars that support the jaw joints and the airway. Yeah, we want them to be caries-free. We want them to be nice and straight. But there's a whole new dynamic that takes place when you start looking beyond just the teeth. And the health ramifications, the quality of life issues with chronic pain and/or sleep-disordered breathing. I think it was clearly said, or clearly documented that if you've got undiagnosed and untreated airway issues of sleep-disordered breathing, obstructive sleep apnea, and over time it'll affect every organ system in your body. It'll affect your cardiovascular system. It'll affect your endocrine system. It'll affect your cognitive abilities during the day. Type 2 diabetes. It's such an all-embracing problem that when we can do something about it, if we have the proper training and we have the proper tools and the proper diagnostic equipment, when we can do something about this, we can absolutely change lives significantly.
Frequently, I'm guessing what happens is someone may be diagnosed with OSA. They are prescribed to use the CPAP device, and they can't tolerate it. What do you do in that instance?
Well, the evaluation for the patient isn't any different whether they're a CPAP failure or not. The evaluation is all about understanding whether this person is a good candidate for what I can offer. I have obstructive sleep apnea. I'm 160 pounds soaking wet and about 5'6.5". So you don't look at the body size necessarily. You look at structural issues. But my job for the patient is not to do the diagnosis, because that's a medical diagnosis. So if they've been diagnosed with sleep apnea and they're on CPAP and they can't tolerate, well, I tolerate it. I already have the diagnosis, okay? But my job is to determine whether that patient is a good candidate for what I can offer. Now, if you're not CPAP compliant, then the oral appliance, in conjunction with certain other measures, perhaps, avoiding alcohol, so weight loss and things like that, is the next best option. But I still have the task at hand when the patient is sitting in my office is to determine whether they're a good candidate or not. And it's interesting that there's a lot of patients out there that are on CPAP that can be effectively treated with an oral appliance. It wasn't that long ago then, and even in some circles now, the medical profession doesn't look favorably, or they haven't quite bought into the efficacy of an oral appliance. So somebody who has mild or moderate sleep apnea, I see them all the time, patients in here with mild and moderate sleep apnea who are on CPAP, and I do my evaluation, and I'm going, gee, you're actually a really good candidate. You have all the signs, and we have many, many measurable signs of whether they're a good candidate or not. So these patients oftentimes, even if they can't tolerate CPAP, there's no compromise by going to an oral appliance. And the reason we know that is because when we treat patients, we always do a follow-up level 3 sleep study. We objectively measure the results of our treatment.
Dr. Lawson, thank you. I'm Scott Drake, and you're watching Sleep Better TV.